Yeah, just a quick review of the IEADEN Precut Kinesiology tape for knees. Kinesiology tape, or KT tape, is what a lot of people call it for short. So this is made specifically for people that are having some kind of knee problem or having knee pain. And the idea is that you put the tape on and it supports the joint and the surrounding soft tissues like the muscles. And that way your knee has a chance to rest, recover. It doesn't get so overstressed as you do things. So a few points about this particular tape. It's made of 95% cotton, which is good because cotton agrees with most people's skin. It does have 5% spandex in it, so it also does stretch as well, which is probably good because you wouldn't want to put regular tape on like duct tape because that won't really flex with your knee. Now you don't want anything that's super flexible either, because what's the point? It's not going to support your knee if it's super flexible, but a little bit of give is actually good, so that way you can go ahead and move your knee a certain amount. It is waterproof, so know that. So if you're going to go swimming, you can, if you have knee pain, you can go ahead and put it on. Sweat-proof as well. Like I said, the flexibility property is really good too. So yeah, other things you can do for your knee besides putting on tape, just a few other ideas for you. Bulletproof your knee is where I'm getting this from. If you have any kind of a knee problem, make sure that you're strengthening your quadriceps muscle, at least one exercise. I'll tell you why. Quadriceps is a big muscle on the top of your leg here. Here's your kneecap or your patella for reference. This is the big stabilizing muscle of your knee joint. It's made up of 4 individual muscles, but collectively it's called the quadriceps or the quads. So research is finding now, you take about anybody with any kind of knee problem, I can probably find a study where researchers have tested the muscles around the knee, and they find it's just the quadriceps muscle that you have a problem with. So it's this selective problem when you have a knee issue that your quadriceps is weak, or some of these studies are also doing CT scans, and they look at cross-sectional area, and they find it's actually smaller than normal. So for instance, knee swelling in the quadriceps, another study demonstrated that even if you have as little as 20 milliliters of fluid in your knee, which is just over a tablespoon, it's enough to decrease the strength of your quadriceps muscle. So if you have any kind of chronic or acute swelling in there, it takes its toll on your quadriceps muscle. It can't contract like it should. Knee injuries in the quadriceps. Here again, people that have maybe fractured your tibia, your lower leg bone. If you've had any prior surgery, they've opened up your knee. Researchers find that you have quadriceps weakness. Ligament problems in the quads. Anterior cruciate ligament, also known as the ACL. You've heard of football players tearing their ACL. So look at this. One study looked at people who have completely ruptured their ACL. Researchers found the strength of their quadriceps muscle in the injured leg was decreased by 25 to 30%. So you take a big stabilizing muscle of your knee and you take its strength down 25 to over a quarter of its strength. It's going to be hard to get better, get back to normal and pain-free if you don't get that strength back. Same thing with the posterior cruciate ligament, medial collateral ligament. Knee pain, when they find people have knee pain, the quadriceps muscle doesn't contract like it should. Knee arthritis in the quadriceps. So that's a good one. So if you take a bunch of people with knee arthritis, or let's say just Google knee arthritis and quadriceps strength, and you'll find just practically every study shows the same thing. People with knee arthritis have weak quads. Like their hamstrings are fine. It's just their quadriceps muscle has a lot of weakness. Likewise, there actually are a lot of randomized controlled trials showing that if you take a bunch of people with knee arthritis and you strengthen just their quadriceps, that their knee pain starts to go away. And some of these studies are even showing that the people that have the stronger quads in these studies have the least progression over time of their knee arthritis. If you got knee arthritis, you got a lot of reasons to strengthen your quads. Patellofemoral pain syndrome, and this goes on and on. So any kind of knee problem, even if it's just non-specific knee pain, make sure you're doing at least one exercise for your quads. Fine-tune control over your knee. Here we're talking about the hip muscles. Occasionally, you have a lot of really bad knee pain, but there's nothing wrong with your knee at all. It's actually, the problem's all up at the hip. Classic case is iliotibial band syndrome. If you take a bunch of people with iliotibial band syndrome and you test their hip abductors, or actually you test all their hip muscles, you find just their hip abductors are weak. None of the others have this profound weakness. And it helps keep your pelvis level every time you take a step, and your hip abductors also bring your leg out to the side. So here again, randomized controlled trials showing if you take people with iliotibial band syndrome and you strengthen just their hip abductors, that the iliotibial band syndrome starts to go away. So that's interesting. Of course, you want to keep your knee flexible. We all know your knee bends and straightens. A lot of people don't know is your knee actually rotates. About the last 10 to 15 degrees of you straightening your leg out, it actually rotates laterally or out to the side. Here's a little test to see if you have that accessory motion. So that's something you can stretch out if you know what stretches to do. And probably the last thing you can consider doing to get your knee fully functional, increasing dynamic knee stability. Here then they're talking about proprioception. So proprioception is your position sense. So like if I suddenly turn off the lights, you'd probably be able to tell me whether your knee is bent or straight. And that's because you have these receptors in your joint around your knee and the muscles around your knee, and they give your brain constant feedback as to where your knee is in space. But what researchers are doing now, they're going out to different patients with different knee problems, and they're testing their proprioception, and they're finding it's decreased. It's not really what it should be. Now, it's not like they don't know where their knee is or anything, because that'd be a true neurological issue. There are some cases like that. But basically, they're just finding it's just not up to normal. So that's something that you need to get back to normal, have a fully functioning knee. But hey, nothing's as quick as putting on a little extra tape here, give your knee some support. A lot of people put it on, say their knee feels a lot better. So there you go. Check it out.